The COVID-19 pandemic exposed and exacerbated long-standing racial disparities in health, economics, and social systems, disproportionately impacting Black communities across the United States and the globe. From higher rates of infection and mortality to greater economic hardships, the effects of the pandemic on Black individuals underscore the need to address systemic inequities that have been entrenched for generations. Understanding how COVID-19 affected Black communities requires examining these disparities across health, employment, housing, education, and mental health. Health disparities and mortality rates. One of the most glaring impacts of COVID-19 on Black communities was the disproportionate health burden. Black individuals contracted the virus, were hospitalized, and died at significantly higher rates than their white counterparts. According to the Centers for Disease Control and Prevention, CDC, Black Americans were approximately twice as likely to die from COVID-19 as white Americans during the early stages of the pandemic. This disparity is rooted in structural inequities. Black communities often have less access to quality healthcare due to systemic racism, including geographic segregation that limits proximity to well-equipped hospitals and clinics. Many Black individuals also face barriers such as underinsurance or lack of insurance, leading to delayed treatment and poorer health outcomes. Furthermore, pre-existing conditions such as hypertension, diabetes, and asthma, prevalent at higher rates among Black individuals due to socioeconomic and environmental factors, heightened vulnerability to severe COVID-19 complications. These conditions are exacerbated by factors like limited access to nutritious food, environmental pollution in predominantly Black neighborhoods, and stress from systemic racism. Economic impact. The economic consequences of the pandemic were particularly devastating for Black workers and families. Black Americans were overrepresented in essential jobs, such as healthcare support, transportation, retail, and food services. While these roles were critical during the pandemic, they often came with low wages, limited benefits, and increased exposure to the virus. This combination placed Black workers at greater health risk while offering little financial security. Unemployment during the pandemic disproportionately affected Black individuals. Many Black-owned businesses faced significant challenges due to limited access to emergency financial assistance, like Paycheck Protection Program, PPP loans, compared to businesses owned by other racial groups. The wealth gap also contributed to the hardship. Black families often had less savings or generational wealth to rely on during economic downturns. The eviction crisis further highlighted the economic struggles of Black communities. Black renters, who were already more likely to spend a disproportionate share of their income on housing, faced higher rates of eviction during the pandemic. This exacerbated housing insecurity and homelessness, destabilizing families and communities. Education and digital divide. The pandemic forced schools to shift to remote learning, revealing and deepening the digital divide that disproportionately affects Black students. Many Black households lacked reliable internet access, sufficient devices for online education, or the necessary quiet spaces for effective learning. According to a report by Pew Research, around 34% of Black households did not have a broadband internet subscription during the pandemic, compared to 21% of white households. These disparities disrupted the education of Black students, leading to significant learning loss. With schools closed, many Black parents, especially those working essential jobs, struggled to provide the support their children needed for remote learning. This widened existing achievement gaps and created long-term educational setbacks. Mental health and well-being. The pandemic's toll on mental health was severe, and Black individuals faced unique challenges. The compounded stress of the health crisis, economic instability, and racial injustices, exemplified by the murder of George Floyd in 2020, created a mental health burden for many Black Americans. Despite the need for mental health support, Black individuals were less likely to seek or receive treatment due to stigma, mistrust of healthcare systems, and limited access to culturally competent care. This disparity has long-term implications for the overall well-being of Black communities. as untreated mental health issues can lead to worsened outcomes in education, employment, and relationships. Systemic racism and public perception. The pandemic laid bare the systemic racism that underpins many societal structures. Black communities were not only disproportionately affected by COVID-19, but also faced blame and stigmatization in some instances. Early narratives framed minority groups as vectors of the virus, perpetuating harmful stereotypes and deepening mistrust between Black communities and public health institutions. Furthermore, vaccine distribution highlighted racial inequities. Black individuals faced barriers to vaccination, including limited access to vaccination sites, transportation challenges, and skepticism rooted in historical medical abuses, such as the Tuskegee syphilis study. Despite these obstacles, community leaders and organizations played a critical role in addressing vaccine hesitancy and ensuring access. Community resilience and advocacy. Amid the challenges, Black communities demonstrated remarkable resilience and solidarity. Grassroots organizations and community leaders mobilized to address the immediate needs of their neighborhoods, from food distribution to advocating for policy changes. Black churches and cultural institutions played vital roles as trusted sources of information, encouraging vaccine uptake and providing emotional and spiritual support. The pandemic also amplified calls for systemic change. The Black Lives Matter movement gained renewed momentum during this time, with many linking the disproportionate impact of COVID-19 on Black communities to broader issues of racial inequality. Protests and advocacy efforts demanded justice, equity, and investment in Black communities to address the underlying causes of these disparities. Policy responses and lessons learned. The pandemic forced policymakers to confront the structural inequalities that worsened its impact on Black communities. Emergency measures such as eviction moratoriums, expanded unemployment benefits, and stimulus payments provided temporary relief, but did not address the root causes of inequities. Moving forward, there is a need for sustained investment in healthcare, education, affordable housing, and economic opportunities for Black individuals. The pandemic also highlighted the importance of data disaggregation. Early in the pandemic, limited reporting on racial and ethnic disparities hindered efforts to understand and address the impact on Black communities. Improved data collection and transparency are critical for informing equitable public health responses in future crises. Conclusion: the COVID-19 pandemic disproportionately affected Black communities, exposing systemic inequities that have persisted for centuries. From higher infection and mortality rates to economic and educational setbacks, Black individuals faced unique challenges that underscore the urgent need for systemic change. At the same time, the resilience and advocacy of Black communities served as a powerful reminder of their strength and determination. Addressing the disparities revealed by the pandemic requires more than temporary relief measures. It demands a commitment to dismantling systemic racism and investing in policies and programs that promote equity. Only through these efforts can society ensure that the lessons of the pandemic lead to lasting change, creating a more just and equitable future for Black communities and beyond.